Hello. This week in CFT 5103, Applied Couples and Relational Therapy, we're focused on Imago and object relations therapy models. We're going to describe the core assumptions and concepts of Imago relationship therapy and object relations therapy. We're going to explore how each model sees early relational experiences influencing adult relationship patterns. We're going to identify key interventions and therapist roles within each model. And we're going to apply each model towards conceptualizing how you will perform partners therapy yourself. We're going to start out with Imago relationship therapy. Imago therapy integrates psychodynamic, attachment, behavioral, and relational concepts into a structured couples therapy model. We're talking about what is Imago relationship therapy. It's a couples therapy model that was developed by spouses Harvell Hendricks and Helen LaKelly Hunt that integrates psychodynamic attachment and relational concepts. It suggests that people are unconsciously drawn to partners who resemble important early caregivers in both positive and painful ways. It views relationship conflict as an opportunity for healing unresolved relational wounds. It uses structured dialogue and communication processes to reduce reactivity and increase empathy, safety, and connection. And it focuses on helping couples move from unconscious conflict patterns towards more intentional and conscious relationships that are hopefully a little bit more positive feeling. Imago therapy views intimate relationships as spaces where old relational wounds become activated, but also where healing and growth can occur. Our key figures are Harvell Hendricks, who co-created Imago relationship therapy, proposed that romantic partners unconsciously resemble important early caregivers, and framed relationship conflict as an opportunity for healing and growth. And then Harvell's spouse, Helen LaKelly Hunt, co-developed Imago relationship therapy and relational dialogue practices, emphasized connection, intentional dialogue, and relational safety. If you go look for research or like writings on this, you will notice that Harvell wrote a lot more than Helen, but they are co-founders of this theory. So, our basic ideas of Imago relationship therapy. Um, there's this idea of the Imago idea, and this has three basic concepts. The Imago idea has this idea that the Imago match is the concept of having chosen a partner that in some way reminds us of our caregivers. The second concept is that the unconscious purpose of intimate partnership is to finish childhood by healing and growing. And then the third concept is that there's a need for each partner to grow and complete the development stages to achieve psycho-emotional adulthood. So this is definitely a developmental model. And then while we're thinking about this model, I want you just to take a second to think about if you've noticed how often people pick partners like their own childhood caregivers. And if you've noticed this, or if you're noticing this now, have you ever thought about why? And have you ever had a theory around like why this happens? Um, and if you have, this might be a model that really speaks to you depending on how close your theory is to Harville and Helen's theory. So continuing on with basic ideas of Imago relationship therapy, the romantic relationship is a three-stage developmental process in Imago therapy. Your first stage is the romantic stage. And we don't focus on that too much. The stage that we focus on in therapy is the second stage, which is the power struggle stage. This stage includes childhood wounds and defenses that create relational frustration. This includes romantic idealization, where it's shifting out of that romantic stage towards this like disappointment and like negativity. This includes partners relying on automatic childhood-based defenses that were likely extremely adaptive in childhood, but are now not as adaptive in these adult relationships. And this stage also includes partners unconsciously recreating early attachment dynamics and this use of like coercive patterns to try and get needs met, again, in a way that was adaptive in early childhood, but is no longer as adaptive. And then the stage we're trying to get to, the goal of Imago relationship therapy is we're trying to get to this like conscious, intentional partnership stage. And that would be our end goal of Imago therapy for the partners that we're working with. So, Imago therapy assumes that intimate relationships can recreate early emotional wounds, but also provides these opportunities for repair and growth that then can get us to that conscious partnership stage in this developmental model. And then continuing on with basic ideas of Imago relationship therapy, we also have the Imago process, which assumes four essentials for intimacy. So this is our first one is being present for and developing differentiation from your partner, communicating through dialogue rather than through parallel monologues, coming from a place of curiosity rather than from a place of judgment and other negativity, and having a relationship based on positive feelings such as liking, appreciation, admiration, acceptance, and other deliberate positive verbal expressions. So, those are our underlying assumptions, our basic ideas of Imago relationships therapy. And then we want to take those and we want to actually do Imago relationship therapy. Um, so we have a very brief therapist guide to doing Imago relationship therapy. So our first step is going to be to establish safety and structure. Initial Imago therapy work focuses on creating safety, strengthening commitment, and redirecting energy towards intentional relationship growth. So, during this stage, you're going to establish the therapist's role as a teacher, facilitator, coach, and model. We're going to help the partners establish safety in their relationship and in the therapy room. We're going to ask the partners to recommit to the relationship and commit to the therapy process. This is a very important part of Imago therapy is to get this like commitment and recommitment, commitment to the therapy process and recommitment to the relationship. And then we're going to help the partners close the exits by identifying and reducing avoided investments that divert energy away from the relationship. One of the easiest ways to do this is an intervention where you just have the partners write a list of all the things that are kind of taking away or like giving them an out from that relationship. And we don't mean like healthy outs, right? We don't mean like we have healthy hobbies. We don't mean that like we have like we have to go to work, things like that. We mean like those things that are really like pulling away from the relationship in a negative way. Our step two is to explore the imago and relationship patterns. As a therapist, you're going to focus on what childhood wounds and emotional experiences are being recreated in this relationship. You're going to explore partners' early relational experiences and attachment injuries, and you're going to identify similarities between important caregivers and current relational dynamics. You're also going to help partners recognize how attraction and conflict may connect to unresolved emotional needs, and you're going to explore recurring relational cycles and emotional triggers. And then we're going to reframe conflict as an opportunity for awareness and for healing. And then in step three, we're going to facilitate the Imago dialogue process. As a therapist, you're going to focus on maintaining structure, redirecting reactive communication, modeling emotional attunement, and supporting regulation during what are likely going to be very vulnerable moments for your clients. You're going to structure conversations to slow reactivity and increase emotional safety. You're going to guide partners through mirroring, validation, and empathy. Um, you're going to help. And when I say, by the way, when I say mirroring, validation, empathy, these aren't like generic terms. Here in a second, we're going to talk about the Imago dialogue, and these are specific stages. So we have of the dialogue. So we have mirroring, that is like a very specific intentional action, validation that is very specific and intentional, and empathy that is very specific and intentional. So those are um, capitalized because we're talking about specific things that we're doing. We're going to help partners speak from personal experiences rather than blame or criticism. If you've ever you're probably familiar to some extent with the idea of like, let's use I statements, make sure we're like speaking from ourselves. That comes from imago therapy. So if you've heard that or if you've used that yourself or like seen that, you already have some experience with imago dialogue and with imago therapy. Um, so we're going to help partners speak from personal experience rather than using blame or criticism. We're going to encourage curiosity about the partner's internal experience, and then we're going to reduce shame, defensiveness, and escalation, and really give space for doing these things by reducing that. So our step 4 is that we're going to increase curiosity and reduce negativity. Um, so an important idea in imago therapy is that we want to come from this place of curiosity. So again, if you've heard these concepts of like, let's come from curiosity, let's make sure that we're coming from curiosity and humility, not from, blame or judgment. That really comes from imagos, this idea of replacing judgment, which is seen as this very like negative thing that like leads towards negativity and leads towards defensiveness and like leads towards unhealthy separation. So we want healthy separation from partner, right? We want some like healthy differentiation, but we don't want this like unhealthy judgment and separation. So the clinical goal in step 4 is to replace judgment and defensiveness with curiosity, creating greater emotional safety and connection. We want to help partners recognize how judgment and criticism increase threat and defensiveness, right? Like these aren't just like, well, judgment's not neutral ever, but like sometimes we get so used to doing it, right? We get so used to judging, it's so used to criticizing that it's almost like second nature just to like immediately say this criticism, immediately like think this judgment. But these also have the like further outcome of increasing these like threats for our partner and this like defensiveness in our partner. And we really that doesn't help us, right? That doesn't make anything better, and that does make things worse. So we also want to encourage curiosity about each partner's internal experience. When we encourage curiosity and when we use curiosity, that really flips the script from this idea of like, what is the other person doing wrong to like, why is that happening? Right? What's going on? What don't I know? What can I better understand? And at the end of the day, like people do things for reasons, right? Like it's again, it's very easy to get stuck in this like judgment and criticism space and forget that if somebody's doing something, there is a reason for it. And that reason may not make sense to us, but it probably doesn't make sense to us because we don't know enough. And even if they're not doing the perfect thing or they're not doing what we would consider the right thing, they still have a logical reason for what they're doing. And if we get curious about that and we can better understand that, that can help us like have a conversation and discussion. Even if our goal is to like move away from that behavior, understanding it helps us have this like non-defensive and non-threatening conversation about it, right? And then we want to reduce negativity and adversarial interaction patterns. And we want to help partners shift from blame towards understanding. So, again, as we reduce judgment, reduce criticism, these all kind of like naturally should follow. And then we're going to increase more emotional safety through this very intentional communication. And then our step 5 is build appreciation and positive connection. Now, something I ran into when with Imago therapy is that folks can sometimes get caught up on this idea of like increasing positivity. Um, because we do have like a problem with like toxic positivity in our culture, right? And so we don't want to do that. We don't want to do the like toxic positivity, but we do want to do like the helpful collaborative positivity, right? So don't get too stuck on this like I don't know, for some folks like positive almost has like a negative connotation at this point, which is a little bit funny. But we don't want to get too stuck on this like connection of positive to toxic positivity because that's not what we're talking about here. We're really talking about those like healthy and collaborative and like good interactions with each other, right? So the mechanism of change is not only repairing wounds, but intentionally strengthening connection through positive relational experiences. So we want to reinforce expressions of appreciation, of admiration, and of acceptance. We want to support emotionally responsive and attuned interactions. We want to help partners create deliberate experiences of positive connection. So like very thought out, not just, spontaneity is in relationships is somewhat a myth and is like very damaging. So we want to like really lean into this like these deliberate intentional experiences. We want to encourage new relational practices outside of therapy, right? Our goal is always to get folks out of therapy, right? Like we do therapy while we need to, and then we graduate from therapy, and that's wonderful. So we want to encourage these intentional practices outside of therapy in in anticipation of the clients no longer being in therapy and still being able to do these things. And then we want to emphasize growth through empathy, responsiveness, and emotional repair. And that should be a continual cycle for the couple moving forward. So, this is our therapist guide to doing Imago relationship therapy. You do have access to this slide set, so you can always come back and check this. Please remember that this is the theory in a snapshot. If you're very interested in this theory, I very much encourage you to go out and look more into it, do reading on it. There should be some readings available in your class, but also there's so much more available out there for you to explore with this theory. So we're going to move on to clinical tools in Imago relationship therapy. And our main clinical tool in Imago relationship therapy is the Imago dialogue. You will use this um, very very much like you yourself will model this in therapy, and you will help the clients use this in therapy. So this is our main clinical tool in Imago relationship therapy, and it's called the Imago dialogue. So the therapist's role during Imago dialogue is to be a teacher, a facilitator, a coach, and a model. You need to maintain emotional structure and pacing, redirect criticism, contempt, or defensiveness, right? Remember, we want to move towards curiosity, away from the criticism, contempt, judgment, defensiveness. We want to slow interactions when escalation occurs. It's so easy to get stuck in this cycle of escalation and sometimes, especially for clients who are just very used to that escalation cycle, that feels safer than slowing things down. So we want to be very patient and we want to like intentionally slow down interactions. That will also make it easier to practice this Imago dialogue by slowing things down intentionally. We're going to help partners remain emotionally engaged and regulated. We're going to like kind of monitor that as we go. And then we're going to model curiosity, empathy, and attunement and help move farther away from that criticism, judgment, contempt, and defensiveness. And then we want to reinforce moments of vulnerability and connection so that those are what really stands out when the couple thinks back over what was going on. Our goals of the Imago dialogue is not immediate agreement or problem solving, right? Like remember, we're not doing toxic positivity, right? We're doing real positivity. So our goal is not to like immediately jump to the end. We don't want to immediately jump to this like forced agreement or like coerced problem solving. We really want this deeper understanding connection. We want to take time for this process and give the couple time for this process because those are the moments when connection occurs, right? We want to reduce our goal is to reduce blame, defensiveness, and that emotional escalation. We want to increase emotional safety and connection. Our goal is to help partners feel heard and understood because, again, that's when connection can occur. We want to encourage curiosity about the partner's internal experiences. Our goal is to create structure during emotionally vulnerable conversations that create space, time for them. And then we're going to foster empathy, validation, and emotional attunement. So you can really see how the goals of the Imago dialogue really just perfectly fit in with the goals of Imago relationship therapy, which is why it's our main clinical tool for this therapy. We have a very specific structure of Imago dialogue. We have a sender, who's the one who like speaks. They speak briefly, but specifically. We use I language. We focus on personal feelings and experiences, and we avoid blame, criticism, and content. And they will need your help to do this at first. They will need reminders. They will need you to step in when they get off course. And as a therapist, it's totally okay for you to do that, to step in and go, oh, I just want to remind you to use I statements. Oh, we just need to avoid blame. I know that feels very weird, but we need to not blame the other person and just talk about how we were feeling and what we were experiencing. And then the receiver is going to mirror accurately, is going to maintain regulation and openness, is going to validate the partner's perspective, is going to respond with empathy and curiosity. And we're going to do this in 3 steps. So, our step one is mirroring. So, remember, we go all the way back here where I said these were capitalized for a reason. So, guide partners through mirroring, validation, and empathy. This is where we're going to get to that, right? So, our step one is mirroring. In mirroring, it helps the partner feel heard while reduces reactive escalation. The receiver repeats back the sender's message as accurately as they can, as well as they can. The goal is understanding, not agreement. So the big thing I'll talk to clients about is you don't need to agree with the person to just like repeat what they said and show that you understand it, right? You just repeating what they said is not you saying I agree with what you're saying, but it is you saying, I heard you. So mirroring shows slows reactivity and reduces assumptions. And then this we also give space for the sender to clarify or expand as needed. And we do this until the sender feels like the partner actually heard and understood what they said. So again, not agree, but heard and understood. So example of some prompts that you could use is can you mirror back what you heard? And then once the partner has like said it, you're gonna then ask the person who was talking originally, you're gonna say, did they get that right? Is there more? Right? So an example of this, and this is a little silly, but we're just gonna do like really, really basic, right? Let's say partner A says something like, I was upset that the cat wasn't fed this morning, right? And then when they say that sentence, you're going to turn to partner B and you're going to say, can you mirror back what you heard? And partner B may say, you were mad I didn't feed the cat, right? And you're going to turn to partner A and you're going to say, did they get that right? And partner A maybe will say yes, but hopefully will say something like, um, I was just upset that the cat didn't get fed this morning. I saw that the cat didn't get fed. I was in a rush and I woke up and then there was no food in the cat bowl. And I realized that the food hadn't moved, and the cat hadn't got fed. And like that was just really upsetting and frustrating for me. And so then you're going to turn back and you're going to ask partner B again, can you mirror what they heard? And maybe partner B will say something like, so you were just busy this morning and it sucked that the cat hadn't been fed and that you had to do that. And then you're going to turn back to partner A and you're going to say, did they get that right? And maybe this time partner says, yeah, I felt like they got that right. And you might ask, is there any more? And partner A goes, no, I think they got it. And then you're good. You got step one in mirroring done. Good job, right? So this is really not like a one and done process. This is really this like we want to get to like definite and complete understanding. So our step two is validation. So validation helps reduce shame and defensiveness while increasing emotional safety. So validation communicates that the partner's experience makes sense from their perspective. Validation is not the same as agreement. Again, like we're not in the like agreement game. We're just in like I understand, I get you. And the focus is understanding the emotional logic behind the experience. So some therapist prompts for this might be, can you see how that experience makes sense for them? So again, we're not agreeing with it. We're just, okay, well, this does make some sense. Or what about their perspective feels understandable? So you're trying to help the partner understand or like recognize what is there. And then some example of validation language the partner can use is things like, I can understand why you would feel that way. So we've already repeated, we've already mirrored back. And then maybe here at the end I ask partner A, is there more? Partner A says, no, no, I think they actually got that. And then I turn to partner B and I say, what about partner's A perspective feels understandable to you? Um, and partner B might say something like, oh yeah, that it does make sense that you were frustrated given what you were experiencing that morning, right? So we're just validating that their experience was logical and it made sense and like that we understand they felt that. And then moving on to empathy, this helps partners move from reactivity towards emotional connection. Because remember, that's our goal, is connection. So empathy involves emotionally attuning to the partner's experience. The receiver imagines what the sender may be feeling emotionally, and emotional attunement deepens connection and vulnerability. So, some example therapist prompts for this, I might turn, the examples here are what emotions do you imagine they may be experiencing? What do you think this moment feels like emotionally for them? So um, I might turn to partner B and say, what do you think they were feeling this morning? And partner B may be saying, I can imagine that they felt frustrated and upset and maybe overwhelmed this morning. And so we're trying to get them to kind of put themselves in that place and imagine what the other person might feel and make those deeper connections with the other person so that we can get away from that judgment, get away from that criticism, get away from those like easy surface level, like, oh well, you just should have, to like, okay, I can connect, I can empathize with this person. So those are our 3 steps of Imago dialogue, and we just do those over and over and over again. And we just get to where it's second nature to do those. And conversations get so much easier when we do those, and connection gets so much better when we do those. So, some common therapist pitfalls in Imago relationship therapy. Imago interventions are most effective when structure, emotional safety, and emotional attunement are balanced. We want to avoid focusing too heavily on dialogue structure while missing underlying emotional process. We want to move into vulnerable dialogue. We don't want to move into vulnerable dialogue before emotional safety and regulation are established. It just won't work. If we try it, we can try it, but like it just won't work. If people don't feel safe, they're really not going to be able to engage in that vulnerable dialogue. And we don't want to allow criticism, defensiveness, or contempt to hide within structured communication. We really want to call that out when we see it and like put a stop to it. As a therapist, we want to step in and say, oh, wait, wait, wait. Right, let's go back. Let's go back to the dialogue. Let's go back. And we don't want it to turn into this like game of like what can I get away with, right? That's not the goal. The goal of therapy is to make the relationship better. And then we want to avoid treating conflict only as communication issue rather than exploring deeper attachment wounds and relational meanings. While our main clinical tool is this communication thing, that is not the end all be all. That is just a tool that is helping us explore these other things, right? We want to avoid joining one partner or reinforcing polarization within the couple system, right? And this is a general like CFT thing overall, but we want to make sure that as much as possible we are aligned with the couple as a whole and with both partners. And then we don't want to overlook cultural, systemic, or contextual factors impacting the relationship. We want to give space for those and recognition to those. All right, so that is our very quick introduction to Imago relationship therapy. If this makes sense to you, or if you find yourself feeling like, oh, I could do this in therapy, I very much encourage you to look into this a little bit more. I'm going to move on to object relations therapy. Object relations therapy integrates psychodynamic and attachment based concepts to understand how early relational experiences shape emotional development, identity, and adult relationship patterns. We're talking about what is object relations therapy. It is a psychodynamic approach that focuses on how early relationships shape emotional development and adult relationship patterns. It emphasizes these internalized templates that people have developed from experiences with caregivers and significant others. It views relationship conflict as influenced by unconscious expectation, fears, defenses, and attachment wounds. In couples or partners work, therapists explore how past relational experiences become activated within present relationships, and therapy focuses on increasing insight, emotional awareness, reflective capacity, and just healthier relational functioning. So, object relations helps therapists understand how the past continues to shape emotional reactions and relationship dynamics in the present. So, it doesn't sound too different in some ways from Imago relationship therapy, right? It shares some underlying um, foundations, especially when it comes to like attachment and our key figures are Melanie Klein, Donald Winnicott, Margaret Mahler, Heinz Kohut, and Otto Kernberg. There are also other key figures I have not included in here. Object relations therapy has quite a few people who have like altered or expanded or just done research into it in really important ways. So these are by no means the only key figures for this theory. Melanie Klein is who introduced early objects relations concept and in conscious relational dynamics and like really emphasized these main concepts of splitting, projection, and internal emotional worlds. Donald Winnicott developed concepts such as the good enough mother. You may have heard this. The good enough mother is the idea that like we don't need to be like perfect caregivers, but we do need to be good enough. And good enough is just good enough, right? Good enough is not perfect. And then also the idea of the true self and false self and focus on emotional attunement and relational development. Margaret Mahler developed separation individuation theory and explored how children develop autonomy while maintaining attachment. Heinz Kohut developed self psychology and the concept of the self object. And we'll talk a little bit more about objects here in just a moment, but Heinz Kohut really came up with this idea of self object and emphasized empathy and the development of self esteem through relationships. And then Otto Kernberg applied object relations concepts to personality organization and couples work, um, again, focused on splitting, aggression, and intense relational dynamics. So, underlying assumptions of object relations therapy. Some of our basic underlying assumptions are this human experience is fundamentally organized around self affect object units. So, this idea that we have like the self object, and then we have other objects like caregivers or experiences that and how they affect our self object. So, object is really just talking about maybe units or like basic concepts, right? This idea that like when we internalize things, we don't like internalize them as these like really complex concepts. We just internalize them as these really as basic of objects as we can get away with internalizing them, which is very adaptive at the moment, but then can cause some stuff later on, right? So there's this idea that the self is not a single unified entity, but is composed of multiple internalized object relationships. That these internalized object relationships become templates for relating to others, and that object relationships are the primary building blocks of both personality and experience. So here are our basic underlying assumptions. Now remember, assumptions of theories are not like definite real facts, right? I just want to like remind everybody of that. They're not like objective facts. There are these like basic ideas that are true within that theory, right? And like how that theory understands things. So we are looking at therapeutic underlying assumptions. Internalized relational patterns emerge and unfold within the therapeutic relationship, especially through transference. So in this relationship, like paying attention to transferences, or in this relationship, in this theory, paying attention to transference is very important. Um, Another therapeutic underlying assumption is that clinical work focuses on recognizing how these object relational patterns are enacted in therapy. And then another is that therapeutic change occurs through understanding and transforming maladaptive relational patterns into healthier ways of relating. So, object relations assumes that partners often experience each other symbolically rather than reacting only to the present moment. So, part of what we're experiencing when we interact with others are these like symbolic templates and symbolic objects that are internal to us rather than what is actually going on in the moment. And if you take a moment to think about this, maybe you can think of a time when you've done this or when other people around you have done this where somebody has said or done something and somebody else reacted to it in a way that just didn't make sense. Um, Based on like what was actually happening in the moment. One of the easier ones to recognize the sin is if I have somebody who has been who maybe grew up in like an abusive household or something like that, who maybe got hit a lot. And let's say somebody near them like raises their hand to go grab something, right? You might see that person flinch away. And that flinching away is not them actually reacting to what is happening in the present moment. They're not reacting to the person raising their hand to like grab something off a shelf. They're reacting to this like template, this symbolic template of somebody raising the hand to hit them, even though that is not what is actually going on in the present moment. So you can probably think of experiences you've had or that you've seen others have where they've not necessarily been reacting to what was actually happening in the present moment. And that is something that object relations assumes is going on with partners. So, moving on with basic ideas of object relations therapy, internal objects and relational templates are a concept here. So, again, objects refers to significant others, especially early caregivers. People internalize emotional experiences with important relationships. And these experiences, these internalized experiences, then become relational templates that influence expectations, fears, and emotional reactions. Individuals may unconsciously expect current partners to respond similarly to important figures from the past, and then couple conflict or partner conflict is often shaped by these activated relational expectations. Important concepts, if we're continuing basic ideas of object relations therapy, important concepts are these concepts of splitting and projection. So, splitting involves viewing self or others as either all good or all bad. You might have heard of this as like black and white thinking, but in this concept, in this theory, we refer to it as splitting. Um, and this occurs especially during periods of emotional stress. So, um, when we kind of like offload some of the rationale onto these old templates, right? Projection occurs when individuals attribute unwanted feelings, fears, or traits onto others. And then protective identification may occur when relational dynamics subtly pressure others into taking on projected roles. These processes often intensify couple conflict and emotional reactivity. And as a therapist, we want to help partners slow down these processes and develop more integrated reflective responses rather than relying on these templates. So again, this is like our underlying and base assumptions and basic ideas. But now we want to move into like how do we actually do object relationship relations therapy? Towards that, I've created a very brief therapist guide to doing object relations therapy. Again, this is a brief 5-step guide. If this theory speaks to you, if you're listening to me talk about it and you're like, oh, yes, this makes so much sense, I definitely encourage you to go out and look at training and look at, reading more and learning more about this theory. But you do have access to this slide set to be able to check out this little brief guide. So, step one, we want to build safety and establish a holding environment. So, the therapist focuses on creating safety, becoming a stable relationship that can contain the couple's anxiety. So, we want to establish a therapeutic environment where intense emotions and uncertainty can be tolerated safety. We want to remain warm, engaged, and responsive without becoming overly directive or problem solving too quickly. You want to resist the urge to immediately reduce symptoms or settle conflicts between partners. So just like with Imago, we don't want to like jump to the end, right? The process is important, and the process is often where connection actually occurs. So we want to resist that urge to immediately reduce symptoms. We want to resist that urge to try and problem solve and settle conflicts with partners. We want to become a psychologically reliable holding presence the couple can use throughout treatment. So, kind of like these container spaces. In step one, we want to help partners feel understood, emotionally contained, and supported within the therapeutic relationship. In step two, we're going to identify relational templates and emotional patterns. The therapist focuses on how the couple relates rather than simply what they're arguing about. I want to listen for recurring interaction cycles rather than becoming focused on the surface issue of the week, right? Like stay out of the content. Well, I mean, like you can do content a little bit, but when I get into process, right? Like we don't want to stay on that surface with content. We want to make sure we are in process. We want to notice emotional tone, silences, nonverbal behaviors, and shifts in affect during sessions. We want to attend to dreams, fantasies, associations, and themes that may reveal unconscious material. We want to explore family of origin experiences that shape internal relational templates, because this is where our templates come from. So, this gives us a lot of insight to what is going on. And we want to look for signs of unconscious, complementary, and repetitive object relational patterns, again, so we can kind of like figure out, map what is going on. Step three, we use transference and countertransference. So again, in these both of these theories, transference is something we actually pay attention to and use, and even to some extent countertransference. The therapist focuses on using the therapy relationship itself as a window into unconscious relational dynamics. We notice how the couple experiences, idealizes, rejects, or uses the therapist in session, right? So we kind of pay attention to how they're interacting with us. We pay attention to emotional reactions, fantasies, bodily responses, and interpersonal pulls. We use negative capability by tolerating uncertainty rather than rushing towards explanations, right? We want to be okay with anxiety. We want to slow everything down. And we view enactments and therapist reactions as information rather than treatment mistakes. So, again, in this case, if you are having countertransference, we need to notice it, we need to pay attention to it, and we need to also try and like understand like what that might be telling us internally about what we're seeing in that relationship. And then we want to consider what role the therapist is being invited or pressured to occupy within the couple's dynamics, right? So we don't really use the word triangulation in this theory. So if you go back to Bowen and triangulating, we don't necessarily use that word, but it's a similar concept that we want to pay attention to, like that triangulation, and what it means about how the couple functions. Or step four, the therapist focuses on, or we want to like interrupt defenses and anxiety. The therapist focuses on linking present conflicts to underlying anxieties and internal object relations. We're going to identify repetitive defenses and interactional patterns that maintain relationship distress. We're going to connect service arguments to deeper fears involving attachment, rejection, independence, or loss. We're going to name patterns as they emerge in the room rather than discussing them abstractly. So it's okay to like actually point out like what is going on at that time. We want to interrupt how anxiety and defenses operate within the couple's relationship, and therapy relationship. And then we want to help partners recognize projections and understand how they shape perceptions of one another. And then for step five, we want to support new relational experiences and templates. So, the mechanism of change is in repeated emotional experiences and insight transforming rigid object relational patterns into these healthier interpersonal templates. The therapist focuses on helping the couple create and internalize healthier ways of relating. So, we're going to help partners identify and reclaim projections placed onto one another. We're going to increase each partner's ability to tolerate anxiety, difference, and emotional complexity. So, again, we never really try to just get rid of anxiety, we just want to increase our ability to tolerate it. We support more realistic and integrated perceptions of self and partner. We strengthen the couple's capacity to emotionally contain and respond to one another. And then we revisit and work through patterns repeatedly until these new relational experiences become possible and we've kind of created new templates, right? So, again, if this makes sense to you, this is a very brief guide. Make sure to go and read more, do more training, things like that. And then we talk about clinical tools in object relations therapy. Um, Rather than where Imago therapy really had this one tool, we have a little bit more than that in object relations therapy. Starting out with the role of the therapist. The therapist functions as a container for anxiety, a holding environment, a transitional object within the partner's relational system. The therapist builds the working alliance through tolerating anxiety, remains supportive but not overly directive, and adapts to the couple's needs without sacrificing therapeutic integrity. So, like, we shouldn't sacrifice our boundaries, right? We shouldn't go outside of healthy boundaries, but we can alter things and change things within therapy as needed, and being adaptable. We want to allow things, the therapist's role is to allow things to emerge rather than pushing interventions too quickly. So we definitely can like slow down and just like wait and understand. And we wait for unconscious material to develop. So we wait for clients to discuss associations, to discuss fantasies, to discuss dreams, and to see what transference is happening. And then we want to help the couple and the partners feel psychologically held and understood in therapy. We have process interventions and object relations therapy that include understanding the presenting problem. We want to explore the couple's immediate concerns, relational distress, and recurring patterns of conflict. We want to attend to the emotional meanings attached to interactions rather than focusing only on surface content. We want to learn from the past. So, another intervention is learn from the past, where we help partners explore how early attachment experiences and relational wounds may shape present emotional reactions and identify how past experiences influence expectations, fears, and interpretations within the relationship. Another one is that we incorporate content transference. So we want to monitor our own emotional reactions within the session, and we use these emotional responses as potential information about relational dynamics, projections, and attachment patterns that we see emerging in that room. Which also means we need to have done a lot of self of the therapist work so that we can do this in like a safe and healthy way, right? So that we can understand our own countertransferences rather than kind of being like taken along for the ride. We want to explore underlying beliefs and meanings. We want to help partners examine the meanings they assign to each other's behaviors and responses. We want to explore how assumptions and emotional interpretations may be influenced by earlier relational experiences. Another one is that we want to create awareness of shared themes. So in this, we identify recurring emotional themes and relational cycles within the couple system, and we talk about these out loud, right? And we explore why partner dynamics feel emotionally familiar or intensely activating for partners. And then another one is to explore the power of the past. We help partners connect present relational reactions to earlier family of origin experiences and attachment patterns. So rather just being something that's happening here and now, we can help them connect that like, okay, well, I'm reacting like this because of this in my childhood. And then we support differentiation between past emotional injuries and our actual present relational realities, right? And then we have therapist language in object relations therapy. So you're going to use reflections of feelings. An example of this is I know these are memories from the past, but how can you but can you see how some of this might be happening now with your partner? Reflections of meaning. An example is I'm interested in whether you can understand what it feels like to experience the situation that way. Paraphrasing, you're going to use paraphrasing. I'd like your partner to better understand how you're feeling right now, but I'm not sure they can fully hear you when the conversation moves more quickly. So we're going to slow down and paraphrase. Summarizing, you've come to some very strong conclusions in this moment. I wonder if right now you may be seeing your partner in the worst possible light. So you're gonna summarize. Can we slow down and consider whether there may be another side to what is happening? Right. And then you're gonna like summarize what's happening here and giving space for both sides. Um, Common therapist pitfalls in object relations work. Remember that mistakes are not failures, but enactments that provide clues about the couple's relational patterns and unconscious dynamics, right? So we want to avoid doing too much, over talking, excessive questioning, directing. If we find ourselves doing this, we might want to consider if we're looking at countertransference. We want to avoid acting from our own anxiety or helplessness, and we want to avoid losing neutrality by siding with one partner. So, this is our very brief introduction to object relations therapy. This therapy speaks to you. Please take time to do some more reading into it, look into training into it, look into just learning more about it. And then, as a final reflection, I would love for you to take some time to think about if you can see yourself using either Imago relation therapy or object relations therapy when you do couple and partner